Hi, my name is Tracy Ryan, and I am the founder of the immunotherapy company NKore, and also the founder of CannaKids. You're listening to Professionally Cannabis.
Where do they go, the smoke rings I blow each night? Oh, what
Today
do
on the
they
pod,
do
we are joined by Tracy Ryan, the founder of NKore, an organisation focused on cancer research and therapeutics derived from cannabis compounds. Many of you may have first come across Tracy within the award-winning film Weed the People, following which she founded CannaKids and Saving Sophie, organisations inspired by the life-changing impact cannabis had had on her daughter Sophie. Now, that's enough from me, and all that's left to say is, Tracy, welcome to the Professionally Cannabis Podcast.
Thank you so much for having me. It is definitely a pleasure to be here today.
And we're very glad to have you on. So the first thing we've got to ask you, of course, and we've heard a bit of it already, but we'd love some more detail, is what led you to the plants?
Trying to save the life of my daughter, honestly, is the number one thing for me. And, by default, helping everyone that falls in line behind her. My daughter Sophie is now 8.5 years old, and honestly, the breath in my lungs, the girl has driven me to do everything that I do today in my daily life in order to not only fight for her, but fight for patients like her that are sick and having to endure extremely toxic therapies that are seeing very little advancements, especially in the pediatric space, which I'll get into a little bit more later. But it all started when Sophie was 8.5 months old. This child was the absolute picture of health when she was born. She was 9 pounds, 7.4 ounces. Took me 3 days to give birth to this kid. She was so big. And she was so healthy and beautiful and happy and just everything my husband and I had ever dreamt of when we decided to have a child, which for me was really a lifelong goal. I've always been a big dreamer, if you will, but my number one priority in my life was always to marry a wonderful man and have a child. I just wanted to be a mom. And I really did change career paths with different careers, such as working in feature films here in Hollywood, in order to ensure that I could be a mother who is present in their child's life and helps to raise them and love them and turn them into the person that they're meant to be. So when my daughter was born, it was, a culmination of over 3 decades of dreaming of what this little baby would be like. And she was everything that I'd ever hoped for and more. And then one day, her left eye began to shake, which is called nystagmus. Through a chain of events, we went to a pediatrician on Monday to have her looked at. By Tuesday, we were seeing an ophthalmologist who was a new mom herself. By Wednesday, we were seeing a neurologist, and the neurologist was like, yeah, the chances of this being anything are like finding a needle in a haystack. So we'll set her up for a scan in 30 days. But the ophthalmologist, being this new mom, she had this weird mommy intuition that something more was happening, and this little girl, our little girl, needed to be seen quicker. So she really went to work for us and started calling the MRI facility at the hospital she was being seen at the time, and kept saying, look, you need to let me know if there's a cancellation. I really want to get this kid in sooner. And there was. That Friday at 6 a.m., there had been a cancellation. So we took Sophie in for a scan, and we were honestly more afraid of the scan and of the anesthesia because she was so little than we were of there ever being anything wrong with her. Even the doctor who came in to meet with us prior to the MRI that was going to be overseeing her case said the same thing. He was like, it would be like finding a needle in a haystack for this to be anything at all. So please try not to worry. So we go home, we take Sophie home after the scan. And then that weekend, the phone rings from an unknown number. And the only people that called me from an unknown number at that time were the people from Kaiser, the hospital. So I'm like, this is strange. What is this? And it was Sophie's pediatrician. And he said to us, I'll never forget it. He goes, Mr. and Mrs. Ryan, what I'm about to tell you is unfortunately going to change your lives. And it was in that moment that all the breath escaped from my body, and I braced for impact because I knew something was coming. And he said, unfortunately, we have found a brain tumor in your daughter's brain. He had to Google it because he'd never even heard of it before. It's so rare, and it's called an optic pathway glioma. And he goes, unfortunately, I don't really know much about these tumors. I've had to look it up to even get any kind of information before calling you. So, I want to set you up to go into oncology on Monday to meet with the oncology team and figure out what the plan is. But the only course of treatment for this is chemo. And this was an 8.5-month-old infant. And so our worlds were immediately rocked in ways that only a parent who's been through this can imagine. And our lives started to crumble around us. Everything that we had looked forward to and our visions of what this child's childhood was going to be like, all in a matter of a second, changed. And it was then that my husband and I looked at each other and we're like, well, what do we even do? How do we navigate this? We knew nothing about pediatric cancer. The only thing that we knew was the St. Jude's commercials that they show here in the States, where you see these, dark, hollow-eyed babies that are extremely sick and skinny and bald. And we're like, oh my God, how is this going to be our child? We met with the oncology team, and I decided a few days later that I was going to put a post up on social media about Sophie. I wanted to create her a little prayer page because my husband and I, we're very, I consider myself a very spiritual person now, not as much religious, but spiritual, because I just believe we're all equal. I believe in, one loving light, and that we should never persecute or look down on each other because of the religion that we follow. That is all just about who we are as people. So, we really believe in God, and I wanted people to pray for this child. I believe in the power of good energy. I believe in the healing power of prayer. So I created a page called Prayers for Sophie on Facebook, which is still up today. And she also has one on Instagram. And in the matter of, from midnight that night until 8:00 the next morning, because of a mommy group I was a member of on Facebook, we had almost 1,000 followers before I even woke up the next day. And through this weird random chain of events that happened through that page and through a post I'd put up, I got connected to Ricki Lake, who is a talk show host, was a talk show host for about 10 years. She's been in iconic movies like Hairspray. She still does many TV shows today and is also a documentary filmmaker and award-winning documentary filmmaker. And we got connected to her and her production partner, Abby Epstein. And they had just recently begun filming a documentary now titled Weed the People, which you mentioned previously, on Netflix. And they asked us, would you like to be a part of this film? We've done all this research on cannabis. We would like for you to look it over. We'd love for you to be a part of the film if you're open to it. And we were like, okay, let's look into this.
Hold on a second here. So
yeah.
Were you asked to be in the film before cannabis as a potential medicine was even on the table?
Yes.
Because there was no medicines available, or what? This sounds so crazy already.
So this was almost 8 years ago, and no one was talking about using medical cannabis. Chemotherapy was an option, Western medicine option for Sophie that we were going to take. But we wanted an adjunct therapy that we could use with her that could hopefully potentiate the effects of the chemotherapy and also help mitigate the very, very harsh side effects of chemo, especially in a child. It makes you very sick. You lose your hair, the vomiting, the diarrhea, just the white blood cells, your immune system bottoming out, your red blood cells bottoming out, and the need of blood transfusions when that happens. So we were really looking for all kinds of different things, from vitamin C infusions to hyperbaric chambers to diet to essential oils to you name it. We were looking at everything. And the only time we'd even heard about cannabis prior to this was when my husband's old roommate contacted us, and he was living in India at the time and was the member of a band called Full Moon Rising. So he was already, he was a self-proclaimed hippie, as it was. And we really thought he was just super high and smoking way too much of this stuff when he recommended we give our child weed. Because this was something I smoked in college and that I, had a lot of fun with, but never something I would give a baby. And then Ricki and Abby step in and they're like, look, no, this is really a medicine. There's research that's been done on this. Here are some publications where it's showing eradication of this disease in gliomas in mice. Here is a patient that was a child where a doctor has, created this video where he's showing that they were putting oil on the baby's pacifier and it was helping the tumor to shrink. And they're like, if you guys are open to using cannabis, then we would love to film your journey. So yeah, it was just kind of this weird, random, out of nowhere. Here's this major celebrity that I grew up with saying, hey, let's give your baby some pot and see what happens. And I was dumbfounded at first. My husband was very stigmatized against cannabis, very stigmatized. I used to smoke every once in a while when he and I met, and prior to he and I meeting, I've always loved cannabis. It makes me very creative. It's not something I would do and go out to a nightclub. I would do it with friends. I would play music. I would, draw, I would paint, whatever. It makes me very creative, makes me much smarter, which I think some people find a little crazy, but it does. It just opens my mind and allows me to come up with my most brilliant ideas. But my husband was very against it. He thought it was a gateway drug. He thought that I was going to end up being some cokehead if I kept smoking pot. So I stopped smoking when I started dating him. And so here we are, full circle, 5 years later after I'd first met him. And we've got a major celebrity saying, hey, let's give your baby some weed and see if it kills your cancer. And we were like, okay, you know, we looked at the research. We talked to her oncologists. We got her oncologists on board. They looked at the research. They're like, look, we don't see anything that could be problematic here as long as you are safe with how you dose and you have somebody that knows what they're doing guide you, which Ricky and Abby provided as someone that had been dosing adults. This was their first pediatric patient. They'd had experience with adults, and now we were going to try Sophie as their first child. So at 9 months old, you guys, I mean, this chubby, delicious little baby takes her first dose of cannabis on camera, which you can see in the film. And yes, there was THC in it.
And could you take us a little bit on the therapeutic journey that Sophie went on with these cannabis medicines and sort of how they impacted her, you know, within this journey?
Absolutely. What we have seen happen in this child's body is miraculous. Time and time and time and time and time again. This kid has been called a miracle more times than I can count. The first 13 months on treatment, she was very, very, very sick in the beginning. Every 3 weeks, or every 2 weeks, actually, 2 to 3 weeks, she was being hospitalized for dehydration from diarrhea and from vomiting. And 4 months in, she just stopped getting sick. She stopped getting the nausea. She stopped getting the upset stomachs. I mean, a little bit here and there, but like the hospital stays and her blood counts dropping, her, you know, white blood cells getting low. She started to build a tolerance to the chemotherapy, if you will, which is not something you traditionally see. Usually it just makes you sicker because it accumulates in your body. And the first several months on treatment, Sophie needed to have a blood transfusion almost every cycle, which was she would get one infusion of chemo in the hospital a week for 4 weeks, and then she'd take 2 weeks off. Well, after, you know, each infusion, like each cycle, she would end up needing a blood transfusion, and she ended up needing like 9 in total that first, 7, 8, 9 months on treatment. Then she just stopped needing them out of the blue. Like her treatment protocol didn't change, nothing. She just stopped needing them. And the doctors were like, we can't explain this. The human body does not work this way. Us, as well as the entire tumor board, we want to give the credit to cannabis, because unless you're giving her something else at home, we don't have an explanation for this. And now this was 8 years ago, when this was like pre-Sanjay Gupta, before he even started talking about using cannabis for epilepsy, which is really what created the big shift here in America. And then not only that, but it's also how she's healed from surgeries. She's now had 3 major brain surgeries. This is just to give a little bit of color, this is a tumor that has a 90+% survival rate, but an 85% recurrence rate. This is not like your stage 2 through 4 brain tumors that are super aggressive and can become metastatic and spread throughout the body. They're centrally located in the brain. By definition, they're a benign tumor. If this tumor was anywhere else in the body, they could cut it out and it would never come back. But because it's in the brain, they still call it cancer, because it can kill the patient without treatment. Absolutely. You need chemotherapy. It's inoperable because it wraps around the optic nerves, and it also, usually grows very deep into the brain as well, which is parts you just can't get to. And so with chemotherapy, it can only arrest the development of these tumors. It can only stop them from growing, but not fully eradicate them. Whereas with regular cancer, when the chemo sees cells that divide fastly, it only gobbles up cells when they're dividing. These tumors grow so slowly, the cells don't divide that often. So, we have been on this journey for a long time because of that. She's done 6.5 years of chemo. She's been stable for over 1.5 years, but most recently had to have a 3rd major brain surgery because of a cyst that formed, which I'll talk about here in a minute. But this, throughout the course of these, the last 8 years of her life, the surgeries that she's had, these 3 major brain surgeries that she's had, 2 of them, because the first one, she was barely on any cannabis at all. She was 1 year old when they did the first surgery, just to make sure they understood what kind of tumor we were dealing with. The next 2 were just as big. The second one was just as big as the first one. This last one was bigger than both of them. And every time, her neurosurgeon was like, I don't understand what I'm seeing. I've never seen a child heal as fast as Sophie does. Even just 3 weeks ago when we went in for a follow-up, her neurosurgeon, who's the chief of the hospital and one of the leading brain surgeons in the country for pediatric brain tumors, it's a top 5 hospital in the US, looked at me and he's like, I just don't understand what keeps happening. His exact words is, I've never seen a child heal as fast as her. And he's just dumbfounded at how quickly she recovers. We know why that's happening now because of research that we're doing at UCLA and research that we have patented and will be hitting the journals in the next 2 to 3 weeks, a top immunology journal, which is very exciting. And what we have discovered is that cannabis is turning on the natural killer cell system, which is the main driver of what's called your innate immune system. So these killer cells, they are responsible for keeping us cancer free because we all have cancer stem cells, which are the seeds to cancer growing in our body at all time or trying to grow. And these natural killer cells are fighting army. They help regulate organ function and homeostasis, and they just keep us healthy. Well, when these cells fail, or there is a lack of these cells, like in my daughter's case, she was born with no natural killer cells in her brain, which we've discovered through studying the cystic fluid off of her brain tumor, then there's nothing to really keep these tumors from not only forming, but stopping and going away at any point, which is, what the chemo comes in and does. It kills that tumor. Or I don't want to say kill because it kind of lays dormant there and can start growing again at any time, but it arrests the development of it. And what the research partner is that I have, Dr. Anahi Jewett, she and I have been working together for 3 years now, all originally because of Sophie's, not this last brain tumor surgery, but the one before. I was desperate to get Sophie more clinical research done. So I landed in Dr. Jewett's lap by this another random chain of events. I don't really believe in randomness. Honestly, I believe we were meant to meet. It was synchronistic. And she had, agreed to take Sophie's brain tumor tissue and plant it into not just regular mice, but humanized mice. And then she also studied Sophie's blood. And when she looked at Sophie's blood, that's when she was like, okay, we need to enroll more patients. I was originally going to take these mice to the Technion Institute in Israel, to Dr. Dedi Mieri, where I'd been raising money for his research over there in cannabinoids, because we wanted to do cannabinoid sensitivity on these mice so we could finally try and figure out a protocol that would work for my daughter. And then Dr. Jewett was like, the mice are staying here. I need more patients. I do not understand what I'm seeing. Your daughter's immune function, her natural killer cell function, is 500 times that of any healthy adult I've ever studied in my entire life. She's a child who should have an immature immune system. She has brain cancer, so her immune function should be broken. She's on 4 chemotherapies, which should have waylaid her immune function. I can't tell you what's going on right now, and I can't explain why she has this brain tumor. And it wasn't until a post-surgical cyst formed in the area that they'd scooped out. They scooped out this big round hole of tumor from her disease 2 brain surgeries ago. That sealed over, caused a post-surgical cyst. It created a lot of swelling in Sophie's brain that started leading to seizures and vomiting, and we had to drain it. And it was from that fluid that Dr. Jewett discovered Sophie just didn't have any natural killer cells at all in her brain. You hear a lot about T cells in cancer treatments, but if you don't fix the NK cells, the T cells are never going to be a cure. They're going to be a protocol that can help extend life and, treat the disease for a short amount of time, but it's going to fail at some point. And that's why we haven't seen immunotherapy become a curative product yet, which is one of the things that I'm working on right now, is bringing these natural killer cell therapeutics to market. I've now licensed a suite of patents. It's 5 patents from UCLA with my team, Dr. Jewett being one of the members of our team. And we're going to be working on not only bringing these supercharged natural killer cell therapeutics to market and a suite of diagnostics that help us understand what your immune function looks like, but we're also hoping to bring a cannabinoid therapeutic to market because of what we discovered in Sophie and the other 16 patients that we enrolled that at the time was using my then CannaKids Therapeutics, which is the company that I built after learning so much about cannabis and seeing so much about what it could do, not just in my child, but the hundreds of other people that I was connected to on social media, and eventually thousands and eventually millions of people around the world that we've watched this plant heal. We were using those products on those patients. Now that company I exited last year and sold, which is now called CK Soul. They've changed the name of it. And it was through this process that we started to really understand what this plant could do. So it was turning on this natural killer cell function, which was making Sophie's immune system function in ways that, science has never seen or studied, which was allowing her to heal so fast from these surgeries. And then we also discovered in humanized mice that we then reverse engineered this into.
I want to jump in there a second, just to get it all straight in my head, because it sounds like you are caring for a very poorly girl at the same time as running a research study and the same time running a business. So I just kind of wanted to draw out what's what and what's going on and what are you doing during this time. So, for instance, you're collaborating with Daddy Mary, but you're also working on a commercial venture. Like, how do all these different things map out?
I'm a bit of a busybody, if you will. I always joke that I have two speeds, fast and asleep, and there's really not a whole lot in between. And you're right. I was doing that. I was caring for this very sick child, my husband and I. I launched a tincture company because I believed in the power of this plant, just from what I'd seen happen in my own daughter, not to mention all the other patients that I was interacting with on social media. We created a secret group on Facebook called CannaKids, which is how CannaKids started. I started it with a group of other moms. We wanted a place where we could all come and congregate and communicate about what was going on without risk of persecution or unlawfulness, because some of these, I was doing everything legally because I lived in California, was able to get Sophie a medical card and get her on cannabis without any worry of, going to jail, even though there are still parents being targeted even in legal states. It was still a bit scary. So it was not really something I was wanting to be super public about because, again, it was so long ago. But it was through this CannaKids secret group that the tincture line was inspired. We launched the tincture line, started working with all these children. Then the adults started coming because we were so successful in helping patients with cancer, autism, epilepsy, severe pain. Then the adults come with all the adult cancers, all the adult conditions, PTSD, fibromyalgia, Crohn's disease. You name it across the board. There's the only thing I've ever seen cannabis make worse is tinnitus, which is a ringing in the ear, which is what I have from being a DJ when I was younger. So I have to really be careful with my cannabis use because if I take too much, my ear just rings like crazy. But outside of that, I've just seen it work so well across the board with all these different conditions. And then I had met Dr. Mary through the documentary, through Weed the People. He's also in the film. Ricky and Abby introduced us. I had a ton of patient data that I'd been collecting because I believed that there was really, really something going on here. So I wanted to track all of our patients as effectively as we could. So we were doing these medical intake forms and we were tracking their progress and tracking what they were taking. And we had a nurse providing dosing guidance from day one because I'm not a medical professional. And unless you're a medical professional, you should not be dosing a patient who's sick, who's on a litany of medications. You just shouldn't do it. Shame on you if you are. Send them to a nurse or a medical professional that understands how pharmaceuticals can interact with cannabinoids, especially in the day of immunotherapy, because many immunotherapies now cannabis is counterintuitive to them and it can block the immunotherapy and keep the immunotherapy from working. Same with seizure medications. There are seizure medications that process through the liver like cannabis does. Now, Keppra is an example, which is what my daughter is on, does not process through the liver. So it processes through the kidney, so it doesn't interfere, but there are many seizure medications that can interfere with cannabis. There are painkillers, heavy opioids that will interact with cannabinoids, and the cannabinoids potentiates the effects of these narcotics, of these heavy painkillers that already can be super addictive and very strong. So you got to work with a medical professional. So, we were providing the guidance with that. I had all of this patient data because of all these different patient types that I was working with. And I told Daddy, I was like, I'd love to give you this. And just here you go for free. You can have it. Please help me figure out how to use this plant more effectively. And by the way, can you help my kid? So I had flown with my girlfriend, Autumn. She and I flew to Israel with a tiny itty bitty sample, the only sample that was left of my daughter's brain tumor from her first brain surgery, which was dead. It wasn't live tissue anymore. So there's only so much you can do with it other than analyze it. And I wanted Daddy to try and regrow this tissue using CRISPR technology, put it into mice, and help me figure out how to treat Soph. Unfortunately, that wasn't successful, but I still continued to raise money for this incredible research he was doing because I wanted to help move this initiative forward. So I had the sick child, I had the tincture line that I was running, and then I had this research that I was trying to raise and did raise millions of dollars for. Trying to just push forward as much as I could because chemo was never going to be the answer for my kid. And these tumors have an 85% recurrence rate because the chemotherapy does not work. And there have only been 4 new drugs in 40 years brought to market for pediatric cancer.
That's mad.
4. in 40. And only 3.8% of all government funding goes to pediatric cancer research. 96.2% goes to adult cancers. So you learn this and you look at your baby. She was a baby. I mean, tiny diapers, not even walking, I don't even think she was crawling at that point. I remember it was so long ago, but you look at this tiny baby and you're like, nobody cares about this child's disease, especially because it's considered survivable. Even St. Jude's wasn't doing research on optic pathway gliomas because they're this, it's this low-grade tumor, and yeah, it wreaks havoc, and yeah, kids have to be sometimes on chemo for 18, 19, 20 years, but hey, they live. So who cares? So I had to do something. And I was literally working my fingers to the bone, all while giving my child as much of my time as humanly possible. Every morning, spending as much time with her as I could, coming home at a decent hour, 5 or 6 o'clock at night, making sure I spent my evenings with her, all while answering emails and taking phone calls. I would stay up until 2 o'clock in the morning, 3 o'clock in the morning, just to keep up with my emails, because I had so many people contacting me, whether it be patients or other scientists or collaborators or people wanting to do business. Like 7 days a week, I was working around the clock with these breaks in between to be a mom, because I was bound and determined to do more for my kid than what medicine was going to be able to do for her. And that's what's led me to where I am today. What's led me to making these discoveries that, cannabis is not just turning on the immune system, but it is attacking and killing cancer stem cells, which are the seeds to cancer, which is the biggest finding in cancer in 100 years. And that's going to be in the journals here in the next couple of weeks, which is massive. It's the biggest finding ever in cannabis, is what my scientist, who's a 30-year cancer researcher, is saying.
And can you talk us a little bit through some of the work and research that you guys are currently working on with Dr. Hewitt? You mentioned before that you have sort of a handful of patents out, and normally when folks are taking out IP, it means that there's something damn good to protect. So we'd love to find out a little bit more.
Yeah, absolutely. It's very exciting. Dr. Jewett has been at UCLA for 30 years. She has been published over 150 times to the top medical journals in the world. She is the woman who discovered the function of the natural killer cell system. We had no idea what these cells did before Dr. Jewett came along. We call her the mother of NK cells. She also built the field. She's the world leader to this day in the space, and no one understands these cells like she does. She just chaired every session for the largest innate killer summit in the world. And she can tell every single scientist there why their science is, they're about to hit a stone wall, because they're not doing this right or that right or the other right. Like nobody gets it like she does. And through all of these discoveries, she has patented these findings. And I now own the patents along with her and my partners, Greg and Tim, through our company NKore, which is NKore, because we believe natural killer cells are the core to wellness. And it's not just cancer that we're seeing these cells work with. There's autoimmune research that's being done. ALS is a big clinical component right now of the research that's being done by another team that we're very friendly with, that's been working with Dr. Jewett. Another gentleman, his brother has ALS. He's trying to save his life, much like me. We're very, very much on a parallel journey. He's trying to save his brother. I'm trying to save my daughter. We both found Dr. Jewett and saw this incredible work that she was doing. And there are 15 tests. That's a diagnostic suite that we now own. We just got confirmation today. We're closing our next round of funding. We're going to contract as we speak. It's going to close very quickly. We've already identified a space right around the corner from UCLA that we're finalizing negotiations with. We will be building our diagnostic lab and our cancer research bench in that facility, which is very exciting. We expect that to have that up and running pretty quickly. And we hope to be taking people's blood samples in here in the next few months. With that, we can tell you whether or not your NK cells are functioning or not. If they are failing and they're broken, disease is on its way. This is the first step in you getting cancers when these cells fail. And Dr. Jewett has published on this many, many, many times. We will be able to tell you if your NK cells are functioning great, just how great they're functioning. And if you're on treatment, then we can tell you throughout that treatment protocol whether or not these therapies are further debilitating your immune function, because without natural killer cells, you will die. Same with COVID and other very aggressive viruses like COVID, whether it be the flu or pneumonia or SARS or, all the different COVID variants. COVID is attacking the immune function and it's attacking natural killer cells. And these patients, our scientists has published twice on this past year alone. And there's a lot of research coming out about it, especially from China, where they study natural killer cells very heavily there. And what they found is in these patients who, they have these different diseases, whether it be diabetes or cancer, or if it's obesity or some sort of autoimmune disease, these patients are succumbing to COVID because it's attacking these, what little functioning NK cells they have left. It's leaving them with no immune function, and the virus just takes over their body. And we believe that the people who are dying, who look otherwise healthy, they look like they're fine. There's people that run marathons that are getting this and dying, is because they have a broken NK cell function. Disease hasn't had time to occur in the body yet. So therefore they think that they're fine, when in fact they're fragile and have no idea, because otherwise they look extremely healthy. You can look and feel extremely healthy and have a broken immune system. And inflammation is the number one cause of that happening. And you just think about all the different things that cause inflammation: stress, poor diet, environmental factors, GMOs, hereditary conditions, genetic mutations. There's all these different things that can lead to inflammation. So she has created a supercharged natural killer cell therapeutic that would then become the treatment option for these patients who are suffering from these different ailments, or that come to find out they have a poorly NK cell function. And we hope to be in human trials here in the next few months for a nebulizer product, which will be for COVID and SARS and pneumonia related issues that will coat the lungs, and also an infusion therapy. After that, our hope is to move into glioblastoma clinical trials. Dr. Jewett has published on full eradication in humanized mice, not just of glioblastoma, but also colorectal, oral, breast, liver, lung, pancreatic, and metastatic disease as a whole. Those publications are live and out there for people to read. Those have been, again, accepted by the biggest journals in the world. And we hope to start with glioblastoma. If we can show safety and we can show efficacy in glioblastoma, then we know this is a treatment that can work for my daughter. So that's our hope. We still have to go into humans. We have had one human patient in Beijing, China. This patient it was through a collaboration Dr. Jewett had. This patient had non-Hodgkin's lymphoma. He got one infusion of natural killer cells, the supercharged natural killer cells from Dr. Jewett's therapeutic suite. In 14 days, his disease was completely gone. He had a hole in the roof of his mouth that was telescoping towards his brain, and that completely closed up. There was a tiny itty bitty little hole still in the roof of his mouth, but it was completely closing. His side effects were he felt better. He had no more pain and inflammation in his mouth. He could eat for the first time. He could sleep for the first time, and he felt like he could run a marathon. And now over almost probably 2.5 years now, almost 3 years later now, he's still cancer-free and side effect-free with just one infusion. So we have a lot of hope for these therapeutics, because we are fixing the problem that allowed the cancer to occur in the first place, allowing your own immune function to then target the disease.
And are these natural killer cells then, are you encouraging the patient to make more of them by giving something that sustains them? Or are you taking natural killer cells, human derived or biosynthesized from another source, and infusing them? And are we no longer talking about an endocannabinoid therapy here? We're not talking about medicines or plants or extracts anymore. We're talking about something else? Just to check I'm following.
That's a great question, because there's multiple answers to it. So we are talking about the endocannabinoid system, because when you take cannabis and it fires up the endocannabinoid system, it produces natural killer cells. So by taking cannabis, you can increase your NK cell function. Hence the reason my daughter's NK cell functions anywhere from 300 to 500x. I'm sorry, 3 to 5x, 300 to 500 times that of any healthy adult my scientist ever seen. My immune functions 3x that of any healthy adult she's studied, because I microdose cannabis every day in the evening for health and wellness, and also for sleep and pain and inflammation and, just aches and pains all over. Now we're going to also create a therapeutic, and we've already found a team of scientists that can help us create this therapeutic that will act against the endocannabinoid system like THC does, because the trials that we have done that's showing that cannabinoids are firing up the natural killer cell system, boosting immunity and attacking and killing cancer stem cells. We used a molecule, the only thing we had access to here in the United States without a Schedule I license, which is very, very difficult to get. This molecule that we got replicates THC in the system. So we intend on having that as a combo therapy. The supercharged natural killer cell therapy is its own therapy that turns natural killer cells on. That's not available to the public yet and won't be available to the mass public for potentially, 3 to 5 years because of the process we have to go down. In the interim, we were telling people to take medical cannabis because we have watched it in our trials, in humans, in humanized mice, have published on it, and have also patented it, that it does in fact reignite that cell system. That's why you're seeing patients take cannabinoids and get better. Now, some of them don't get better that have cancer. So why is that happening? Well, the answer is we really don't know, but we have a theory. Our theory, a lot of these patients, when they come to us, they've already been on treatment for a long time. They've been sick for a long time. It's a last line of defense in many situations with these patients. And we believe that by the time they get to us, if they succumb to their disease, it's because they just don't have any natural killer cells, enough natural killer cells left to even turn them on in the first place, because they've been so destroyed by chemotherapy, radiation, combo of the two, and also the disease itself. That's a theory that has not been proven. So I have to be very clear about that. I want to be very factual about how I communicate my information. So
this is not FDA certified and things
no,
like that. Yeah.
Exactly. This is a theory. This is an absolute theory.
This is a hypothesis, actually.
It's exactly. It is a hypothesis, because we've seen patients who are absolutely terminal, who have no chance of living, who aren't even on chemotherapy anymore, come to us and start taking medical cannabis and go into full remission.
With regard to that, what type of products, cannabinoid mix and delivery mechanisms do you find, or do you advise folks who are looking to take medical cannabis as an interim? What are you finding works best for folks who are engaging in this?
We have always used oil, always, for patients. I don't ever recommend a patient eat anything with sugar in it. Dr. Jewett has proven in her humanized mice trials that sugar and saturated fats make cancer grow faster. Even though doctors are like, oh, there's no proof. Well, we've published on it. So yes, there is proof. You do not need to be eating sugar, and you do not need to be eating saturated fats while you're sick. It leads to more inflammation. It makes the disease grow faster. It feeds the disease and makes you sicker. So we definitely, recommend the oil versus an edible that's going to have sugar and preservatives and other additives in it. We were using our CannaKids oil for quite some time, the entire time, essentially. And like I mentioned, that, that product line is now called CK Soul. It's only in California currently, and it's my understanding they're going to be moving more in a hemp direction. But there are a ton of oil products on the shelves today that are incredible and very medicinal. Whole plant. You want a lot of rich cannabinoids, you want a lot of terpenes, and you want to use a nurse's guided assistance. In the United States, every single state is different from, whether it's illegal or illegal. You can be illegal in one state, and you can cross state lines, and you can go to jail in the next state. And then you can go to the next state, and that can be legal, but they're not going to have any of the same products that 2 states over had. So it's really important to work with someone that can help you analyze what is available to you. And not only that, but different diseases require different treatment protocols. How we treat leukemia is not how we treat glioblastoma, is not how we would treat Crohn's disease, is not how we would treat fibromyalgia or PTSD or severe pain. They're all different protocols. And a lot of it has to do also with the patient, the age, the pharmaceuticals that they're on, and also what side effects they're having and what it is they're actually trying to mitigate. Some people that have cancer just want to treat side effects, whereas other people want to take a much larger dose and go after treating the disease, because you can treat the side effects of chemotherapy, like nausea, for example, with a very, very low dose of THC. It's a very low dose of THC that you use for nausea, because you get that relief from nausea when you're coming down from the cannabis on the back side of it, because that's when you get the munchies, is when you start coming down from the peak. So, you take a couple milligrams of THC and you can mitigate a lot of the nausea and loss of appetite. But if you want to treat the cancer, you're going to have to take, a few hundred milligrams, and you work up slowly to that. And that's the other thing that's really important is you can get to very, very high doses of THC and never be extremely psychoactive if you know how to dose it properly. And you start very slow and you increase the cannabis every few days, every 3 to 5 days or 5 to 7 days. Some people are more sensitive than others. My husband, for example, is 6'5". I'm 5'8". I can take 4 times the amount of cannabis than he can, and I'm half his size, and all because of how he processes things. Same with alcohol. Like, he processes things very slowly, so
well, you did say he was a bit square.
He used to be, not anymore. he would take as much cannabis as I do if he could handle it. So he loves it. He thinks it's amazing, and it has helped him in so many ways with aches and pains and sleeplessness, just like me. It also helps keep us happy because it just quietens down that noise. I believe it makes me a better wife and mother. He can always tell when I've eaten 5 milligrams. He's like, did you take an edible? Because you're in a really good mood right now. And I was like, matter of fact, I did. So it just, it has so many wonderful benefits. And I always say, if everybody could just crawl inside my brain for 5 minutes and know what I know and see what I've seen, we would not be having these legal battles over whether or not it should be legal and accessible to all. Now, does it need to be regulated? Absolutely. I just read an article today. I think it was in Oklahoma. I don't remember what state it was. I apologize if I get the state wrong, but there were these chip bags of Frito-Lays and Pringles chips, or not Pringles chips, but Lay's potato chips. Yeah. But it was 3 bags of chips, like Cheetos, potato chips, and Fritos. And it had a little warning symbol on the bottom, which was a California warning symbol, even though I highly doubt it came from California. And it said THC 600 milligrams. So these bags, these Frito-Lay bags that look like real chip bags from Frito-Lay, had 600 milligrams of cannabis in them. And multiple people ended up in the emergency room because they'd eaten this bag of chips, not knowing, I'm sure, that there was 600 milligrams in it. And they just completely lost their mind and freaked out and was probably, hanging on to the grass, growing from the floor to keep from flying upside down is probably what they felt like.
But I think it's impressive how if you accidentally drank 100 beers, that would not be your reaction. I mean, it would be fatal. And that speaks to the sort of the wide tolerance of cannabis as a medicine, which I think, again, just from your perspective as well, when you say that the regulation on it, the fact that it even occurs, I think what I have to do is thank you for letting our listeners crawl inside your brain for 5 minutes, because that's kind of the information we need to share as we see these regulatory changes.
Well, yeah, and you're so right. Like, if you take anything in that large of a dose, it's going to be fatal. But cannabis does not. It is basically impossible to die from cannabis, from an overdose of cannabis. And it is less addictive than coffee and chocolate and sugar as a whole. It has taken my husband so much time to wean off of coffee. He's like in the middle of this major coffee wean right now. And I looked at him last night. We were talking about it. I was like, I want you to think about that for a minute. Think about how long you're having to spread out your coffee decrease in order to not get migraines. Because he suffers from really bad headaches if he doesn't drink enough coffee. He had to get medication for it. And I'm like, and then think about cannabis and think about how we take cannabis every single night of the week. And we could stop and never need it again, never want it again. We'd have no reactions in our body. I mean, it's mind-boggling to me that we have something so incredibly therapeutic that has been proven over and over and over in clinical research to be safe. We have so much safety data on this plant, but yet it is still a Schedule I narcotic. And that is why I'm so excited that this publication is finally about to hit the journals, because I'm now going to go to my friends in Congress, United States Congress. I've got a really good friend there named Congressman Eric Swalwell, who already had gotten a letter signed with 30 bipartisan signatures on it to deschedule for research that he got onto the AG's desk. But it's been in the middle of this, Trumpism and all the chaos that has ensued in the United States. So it didn't really get much further than that, especially with all the back and forth with the attorney generals and what was going on there. And he wanted to get me in front of the House to testify and to Speaker Pelosi to meet with her, to get her on board, because she's a little more old school when it comes to cannabis. But I wanted to wait until I had real hard science accepted by a major journal, not just a lower level cannabis journal that, gets attention, but isn't considered one of the bigger journals. I wanted to go into a real immunology journal, big journal. And I wanted proof that it really was doing to cancer what I was watching it do to cancer every day of my life in these patients. It was saving so many of them, not all of them, because again, some of them still succumb to their disease, but the benefits that it brought them in that time were invaluable. And some cancers, cannabis doesn't work for at all, like glioblastoma. It's not going to cure. I don't even want to use the word cure. It's not going to kill glioblastoma. It could extend your life. Same with DIPG. That's in the brainstem. There's very little receptors there. There are some, but there's not a lot. And I've never seen it save the life of a patient with DIPG. I've seen a major life extension, but that's it. But still, nonetheless, the patients I have seen it save that were terminal with no chance of survival and that were just in general so sick they couldn't even crawl out of bed in the morning is unbelievable.
I mean, between the research and the political side alone and getting a product out to market, we're gonna have a lot to talk about in probably not too long. So I think I've got to thank you there for the time we've had today. You've been a wonderful guest, Tracy, and we've been very happy to have you on. And yeah, we're going to have to talk again soon.
So much happening and so much to cover. Like I said, I could speak for 3 hours and still not have covered everything. But I do thank you guys so much for having me. It is so important that we continue to support this plant and support, this forward motion that we're seeing in the industry to use it as a true therapeutic, because it really is. And, with podcasts like this and opportunities like this, it just helps us further educate people and help them understand what the opportunity is should they become sick and need something to help them walk their way to wellness.
Please take me above, take me